For more on this, we're now reaching out once again to Dr. Isaac Bogosh. Of course, he's an infectious disease specialist at Toronto General Hospital. But today we're actually reaching him in Abu Dhabi. And interesting, there you are working, and you have now received this message, like every other Canadian around the world, to come back home. So talk to us about any concerns that you might have as you try to make your way back to Canada, Dr. Bogosh.
Yeah, well, first of all, I'm out of here. I mean, the message was loud and clear from the Canadian government, and I'm on the next plane home. So, obviously, we have to all listen to the leadership and the health authorities of Canada. These rules apply to everybody. I'm here on working on coronavirus responses at a global level, but it's time to come home. And, like anyone else, I'm going to take the regular precautions in airports and in airplanes. I'm going to distance myself from other people as much as I can. I have my alcohol hand sanitizer. I'm going to use it liberally. And hopefully I'm home in a short while and back in Canada. I'm not planning on going anywhere.
Well, we certainly like you to come home because we like talking to you about all our COVID-19 questions. And so whether or not you're there or not back here quite yet, I do want to ask about what's happening here in Canada and it begins really with this whole issue of trying to flatten the curve, as we keep hearing from health officials. Can you explain, for people who don't really understand what that means right now, what does flatten the curve actually mean, and how are all the restrictions that we're now seeing, how is all that meant to achieve that goal?
Yeah, so flattening the curve really refers to what we call the epidemic curve. And if you imagine the number of cases of coronavirus plotted through time, we're seeing more and more and more of these. And what we often see, and what we've seen actually, for example, in Italy and in Hubei province in China and in Iran, is that the curve went like this. It goes up and then it just has this really large spike in cases over a short period of time. We don't want that. That is the antithesis of what we want. That means that there's a rapid increase in case numbers, and that can overwhelm a healthcare system. We cannot provide a perfect or high quality healthcare if we just have this tremendous influx in cases presenting to hospitals. So what we do is flattening the curve means instead of having this large influx in cases, we take certain measures, and we'll talk about that in a second, like social measures, to have, rather than this rapid upswing, we have this sort of blunted, flattened curve, and then that takes a little bit of time to start to come down. So that's flattening the curve. But basically, it means avoiding large, rapid upswings in the number of new cases.
Okay, so that's the goal, but here we are still seeing these numbers go up right across the country. Provinces now reporting where they've never reported before presumptive cases, if not confirmed cases. So does that mean that the containment efforts have not been working?
Well, containment really refers to ensuring that, the infection is elsewhere, and, we have these policies to prevent it from spreading. But we're really into what we would call a mitigation strategy, where we completely accept that there's going to be cases in Canada. We completely accept that we might import cases, and not only that we'll have locally acquired cases in Canada, and by accepting that and by appreciating that this is going to happen, we can take measures to say, okay, we're going to try to limit the number of new cases in Canada, even though we know we're going to get them. So we're really into a mitigation mode here.
Okay, mitigation mode, no longer containment. So does that mean that we need to look at maybe stricter regulations when it comes to quarantines or even border controls, perhaps even closing the U.S. border to stop travel back and forth? Do we need to look at stepping up those types of measures now?
Yeah, I mean, certainly the first approach is these social distancing policies, and that's a no-brainer. And we've heard about this time and time again, and really the time is now to start enacting these. We can do this at an individual level, plus at an organizational level. At an individual level, we know what to do. We know we're not going to go to crowded restaurants. We know we're not going to go out to nightclubs. We know we're not going to go into busy places. We're going to keep our distance from other people and avoid large crowds and avoid contributing to large crowds. At an organizational level, it's really important for businesses across the country to do their best to ensure that people have the ability to work from home and really spread it out. In addition to that, it's extremely important for businesses and organizations to be lenient on sick leave. It is fair to have someone come into the office or come into work who is unwell because of a sick leave policy and infect other people. I appreciate Many people are living from paycheck to paycheck, and it is not fair to put pressure on those individuals or anyone to come into work because there's a strict sick leave or sick day policy. Now is the time for leniency on those to really ensure that we can practice social distancing, because now is the time to do it, because if we don't do it now, if we wait to do this on a broad scale, we're going to start to see a rapid spike in cases. So we can flatten that curve with those measures.
So not yet at the point of closing borders like we're seeing in European countries, but dealing right now with social distancing and trying to perfect that.
Yeah, but I mean, it's interesting because I'm very curious to see how our health officials will respond with border measures. Now, certainly if we think about the World Health Organization and the IHR, the International Health Regulations that discuss trade and travel during the course of an epidemic, they say don't close the borders down. But of course we're seeing this happen across the globe, and certainly restricting travel can slow down the course of an epidemic. It's not going to stop it, but it certainly can slow it down. And if our Canadian officials believe that restricting travel will slow such that we can flatten the curve, I'm happy with whatever they're happy with.
Okay. Well, listen, quickly running out of time, but I do want to ask you, because I keep getting messages from our viewers, and they are so right now discouraged. Some of them are feeling fear. And I wonder, as you, who's been looking at the global picture of COVID-19, is there anything that we can take away globally that might give people some hope and perhaps give them the message, be cautious, but don't be so scared that you're not living your life?
Yeah, I think there's two things. I think one, we have to remember that the vast majority of people who get this infection are actually going to be just fine. And really what we're doing is we're preventing the vulnerable populations that are more likely to have a bit of a more severe outcome from getting this infection. But the vast majority of people are going to be okay from this. So that's one point. The next point is, you've seen countries like Italy and Iran really overwhelm their healthcare system. We don't need to do that. We don't need to follow that pathway. And there's other countries like South Korea that have taken, and Japan, that have taken a completely different trajectory and have managed this rather well. So we can certainly take the path of South Korea and Japan, but the only way we can take those paths is if we start practicing our social distancing, and we're all in it together. We really are all in this together, and it only works if we all buy into this. So Canada, from coast to coast, everyone involved, we really social distancing measures at the individual level and at the organizational level, so we can have a much easier course with this epidemic.
Okay, Isaac, thank you. Always good to speak with you. Appreciate that. And Dr. Isaac Bogosh is an infectious disease specialist from Toronto General Hospital right now in Abu Dhabi.